morning, Commissioner. For the record, my name is Sam Caligiuri. I'm the state senator from the 16th Senatorial District. The 16th District covers part of Waterbury, part of Cheshire, all of Woolcott, and all of Southington, and I would just point out all four of those towns are within the service area, covered and protected by the Health Center of Greater Waterbury. I want to note for the record that State Representative Al Adinolfi from Cheshire did not sign up to speak, but he wanted me to note for the record that he would like to associate himself with my remarks this morning. Commissioner, I want to thank you for considering the applicant's request for an extension to continue to operate the Health Center until January of 2009. I understand that that is the limited focus of today's hearing, so I'm going to limit myself to comments that I believe are relevant to that issue, Commissioner. Commissioner, I would respectfully urge you to grant this extension, which I believe is the right thing to do as a matter of public policy, as a matter of common sense, and as a matter of law. And I'd like to briefly touch on each of those points. When the original agreed settlement was entered into, which resulted in the creation of the Heart Center of Greater Waterbury, OHCA made a number of critical findings that remain relevant to the current issue before you today, and I'd like to summarize some of those findings. First, that there were no providers at that time of angioplasty or open heart surgery in the service area, and that the nearest providers of those services were at least 30 miles away. Second, that studies at the time showed that the greater the amount of what is called door-to-balloon time, which is the time from hospital to angioplasty, the higher the morbidity rate. In fact, studies show that a 2-hour door-to-balloon time resulted in an increase of about 40 to 60% in the morbidity rate when compared to the ideal 1-hour time of door-to-balloon. OHCA found at the time, and I quote, that there is a direct relationship between the time it takes a patient to undergo primary angioplasty and the outcome. OHCA also found that the proposal for the Heart Center would help provide what OHCA called, and I quote, ideal and recommended standards for intervention. OHCA also noted in that original agreed settlement that because the Waterbury area has an older population with a higher rate of ischemic heart disease, and I quote, residents of the Greater Waterbury area are transferred to full-service cardiac facilities for further treatment, with the resultant disruption in the continuity of care. OHCA concluded by saying that it believed at the time that the proposal for the Heart Center in Waterbury will guarantee, and I quote again, the availability of a quality primary and elective angioplasty and open heart surgery for the citizens of the Greater Waterbury area. Well, in my view, Commissioner, OHCA was right when it made these findings, and the existence of the Heart Center in the Greater Waterbury area has improved the quality of care for residents in that area tremendously, as the agreed settlement anticipated it would. I know that in the separate filing, the Heart Center has shown, at least in one of its interrogatories, that over the last 3 or so years, they've been able to reduce the door-to-balloon time from approximately 155 minutes to 66 minutes, which is very close to the 60-minute ideal time. According to your very own findings, which I just referenced a moment ago, this success means that the Heart Center has helped to save lives and improve the quality of cardiac care in the Greater Waterbury region. I can tell you on a personal note what a blessing it would have been at the time to have the Heart Center in Waterbury when my father was being carted between Waterbury and Bridgeport numerous times for angioplasty and for open heart surgery. We went through that experience. He wasn't able to benefit from the presence of the Heart Center in Waterbury, but I'm so grateful that others have over the last several years. Respectfully, that's why I don't believe it makes any sense for you not to grant the extension. You have an existing program in Waterbury that is working well. It is providing high-quality care that is saving lives. The Heart Center, as you know, anticipates submitting an application for a new certificate of need. They will be doing so very shortly, and they expect that process to be completed within the time period of the requested extension. The requested extension would enable the Heart Center to continue to function, and I emphasize, save lives, while that application is pending. As a matter of public policy, at least in this legislator's opinion, it would make no sense to shut them down for 6 months while they go through this process, that would be an overly legalistic conclusion with potentially disastrous real-world consequences to the people who live in this region. Why close the facility down and cause the resulting increase in door-to-balloon time, for example, which can result in increased deaths, when just 6 months later, OHCA may very well grant the Heart Center a new CON? That cannot possibly be the right public policy for the state of Connecticut. Furthermore, there has been what, in my opinion, is a very important change in the conditions surrounding the Heart Center that I believe you must take into consideration. Because of pressure from the state of Connecticut, Waterbury and St. Mary's hospitals have announced their intentions to merge. When the hospitals presented their merger plans to the state this winter, they included projected financial statements that assumed revenue from the Heart Center. Losing this revenue could be devastating to the proposed combined hospital. It would be unconscionable, in my opinion, Commissioner, for the state on the one hand to encourage, pressure, whatever the right term is, these two hospitals to merge, and then on the other hand to take away from the merged institution the revenue that would be critical for its survival. That cannot, again, possibly be the right result under the public policy of the state of Connecticut. Now, this factor, as I wrap up, Commissioner, is relevant to the question, in my opinion, of whether to grant the extension, because the extension would serve as a bridge during which the services could continue to be provided and the resulting revenue can continue to be generated while the new CON is being considered. One brief note on the law, and you have plenty of lawyers, so you don't need another one talking with you today about the law, but I can't resist. Under Section 4-181A(b), which I understand is the basis on which you're going to be making this decision, Commissioner, you have the authority to modify an order at any time under the UAPA on the showing of what's called change conditions. My staff and I research what that has meant over the years, as I'm sure your staff has or will, and which I'm sure you'll be hearing from others on later this morning. But Connecticut courts and legal commentators have observed that agencies have very broad discretion to find that change circumstances have occurred. And when we went through and reviewed administrative decisions of Connecticut agencies where there was a finding that there was a change condition, it makes very clear that agencies have used that latitude very broadly. There was one decision in particular made by the DPUC in which they found that changed economic conditions was a sufficient condition of change of condition to justify the modification of an order. And I point that out specifically because I believe that goes to the heart of the legal basis that you can utilize for granting the extension. Although I know that the Heart Center will address the various factors that they believe constitute change conditions, I urge you to view, at least in my opinion, the announced intentions of the hospitals to merge, which is clearly a result of state pressure, as a change condition that as a matter of law would justify your granting the requested extension. Commissioner, for the foregoing reasons, and as a matter of law, sound public policy, and common sense and decency, I urge you to please grant the applicant's request for an extension. Thank you very much.
Thank you for your well-researched testimony. I'd like to now introduce Representative Berger and Representative D'Amelio.